Hey everyone, welcome back to the Sports Psych Show. Now today I'm speaking with clinical psychologist Dr Kathy Adcock. Kathy, welcome to the Sports Psych Show.
Hi, thanks for having me.
Now I'm really excited to have you on the Sports Psych Show, Kathy, because you are a fantastic combination of clinical psychologist and sporting fan, or at least boxing fan. You're a boxer yourself and you coach boxing and you've engaged young people within the boxing or to engage in boxing to help them from a mental health perspective. But before we get onto all of that, what would be fantastic is if you can introduce yourself to the audience and talk a little bit about how you became a clinical psychologist and what you're doing right now.
Okay, sure. So, I guess I was a clinical psychologist before I was a boxer. It's quite a long career route to try and get qualified, and you've got to be quite committed to the job. So I qualified as a clin psych in 2009, and I've always been particularly interested in community psychology, and I guess by that I mean the kind of psychology that is embedded within local communities and systems and isn't necessarily taking place within a clinic and within the kind of power structures that come from being within a clinic. So I guess clinical psychology was kind of trotting along and I was working in the NHS. Meanwhile, I started boxing, which I started kind of recreationally in a commercial gym and thought that I was boxing properly, and then joined a boxing club and realised I was not boxing properly and there was a lot to learn. So that was pretty cool. And then I just kind of got the bug with boxing and really got into it and started thinking whilst I was in it just about what a kind of unique sport it is in terms of the kind of combination of the kind of aggression and the high impact nature of the sport and the very kind of intense relationship you have with your coach as a boxer and it being like a solo sport. And I guess I started kind of thinking around how I could think about my work with children and young people in child and adolescent mental health services and think about how boxing could maybe be of use to them. So I sort of started a social enterprise, which is called In Your Corner, and I'm the founder and director of that social enterprise. And essentially what we do is combine non-contact boxing with evidence-based ideas from psychological intervention, and we deliver those flexibly within community settings to improve emotional well-being in young people. And I guess the idea of that is that lots of young people, particularly the kind of young people I'm interested in working with, so they're often young people who've experienced a lot of trauma, a lot of adversity in their environments before we meet them. They're not the kind of young people who, if you say, I'd like to help you, come to my clinic and sit down and talk to me about your feelings. They are not the kind of young people who will say, yes, okay, I'll see you at 2:00. They don't come to clinic, they don't trust adults, and they don't necessarily identify themselves as being young people who need help or would benefit from thinking or talking about feelings. So really the problem I was trying to solve within Your Corner was to try and reach those young people, and that's what we try to do by boxing projects with combined clinical psychology within London.
Fantastic. I actually found you and your work on Twitter. The combination of clinical psychology and boxing piqued my interest and noticed, and it's a great combination. And I noticed that you had written a paper based around your work with your social enterprise In Your Corner. And the paper is called Using Psychologically Informed Boxing Groups to Reach Young People. And as I actually said to you off air there, I had just delivered a presentation on psychologically informed environments. I was like, oh, wow, this looks fantastic. So obviously that's why I got in touch and to get you on the Sports Psych Show. And so we're going to have a chat around this paper and the brilliant things you're doing within the community, linking boxing with mental health. And one of the things that hit me, I started to read this paper, and one of the things that hit me, and you've kind of mentioned this already, is that young people with certain challenges within our environment, within our community, ordinarily they won't sit down with an adult, they won't necessarily sit down with a clinical psychologist and talk about some of the challenges that they're facing. And all too often we cut them off by saying, well, they don't want to know, they're not interested. But I love how you start this piece, and you say that to reach young people, we have to find the right vehicles here. And it strikes me that that's a much more open-minded way, of delivering this stuff.
Yeah, I mean, I think it's a really big ask. I mean, I don't know what you were like as a teenager, but I know what I was like. And I think I'm not sure I knew what I was thinking or feeling most of the time. Yeah. I think if I was finding anything hard, I'm not sure I would have even known that I was finding it hard unless someone else sort of helped me stop and think about it. Yeah. And I suppose one of the things that I say in the paper, and one of the things I'm kind of interested in challenging, is this narrative around hard to engage young people, because young people can engage with things that fit for them, that they want to engage with. And actually it's I think services are doing them a bit of a disservice if they offer them a couple of appointments and then say, oh, they didn't come, so they're hard to engage, so we'll close the case and, maybe we'll see them in 2 years' time when things are worse. I just think, actually, how can services do something different for children and young people, and for adults, to be honest, because actually, in order to be helpful, you've got to provide something in a kind of environment and a relationship that feels okay for a young person to take a risk on. And so if we can do that in a boxing gym, because it feels okay to go to a boxing gym and it feels okay to give this thing a go, then I think that's great if we can kind of come at it a bit differently.
Well, and there's two factors at play. From my perspective, or my perception, is that boxing has historically always been a great vehicle for change. It's always been a sport that's known for helping perhaps people from a deprived area or disaffected individuals, helping them manage themselves better and helping them come back into the community. And also it strikes me, as you say, as a teenager, going to a boxing gym sounds pretty cool, so there seems to be that wonderful cocktail there.
Well, I mean, I think boxing's pretty cool. And I suppose it's got that pull because it's not often like the kind of sport that you do in school. Like, I know you can get boxing in some schools, but in the main, if people want to try it, they've got to kind of find it somewhere. So I think it's got that appeal of like, I haven't done it before. I mean, we particularly work with young men, and obviously it's got kind of, what's the word, like validity, like appeal to young men. They definitely, engage with the idea of giving it a go. And I suppose for me, it's about adding on to that really great history that boxing's got, because like there's so many stories of boxers that have come from adverse backgrounds that have really overcome things, like Anthony Joshua starting boxing when he was on tag, like all those kind of things. Actually, there's a really strong narrative around boxing helping young people, particularly like with this idea that it's highly structured, there's male role models, it's very disciplined, it's quite high intensity training, so you're in the gym a lot, so it keeps you out of trouble. Yep. But from a kind of psychological perspective, I think you can do even more with it. Does that make sense? So like actually, yes, it is highly structured and yes, all those factors are true, but actually, wouldn't it be even better if what we do is really, really work those environments and really, really work those relationships so they can be therapeutic? So they're not just structured and disciplined and active, but they are actively therapeutic so that they can do something kind of even more powerful. And that's what we're trying to do.
And I assume that's what you mean by the title Psychologically Informed Boxing Group. So what I hear you say there, Kathy, that I think is very pertinent, is yes, boxing can help. Yes, historically it's helped. Yes, there's evidence for that. But it's not just the boxing alone. And actually, it's yes, the boxing can deliver structure and all these great things, physical fitness, that can help young people perhaps become more highly conscientious, if you like. But if we can get them in that environment and deliver some psychosocial stuff, some emotional management interventions, then that is going to be a great combination.
Yeah, absolutely. So it's something about kind of supercharging the powers boxing already has by tweaking them with clinical psychology knowledge, actually. So like we ask a lot of our boxing coaches. So when we work with young people, we tend to have someone lead the boxing and someone lead the thinking. and we kind of alternate depending on who's doing what. But, we ask a lot of our coaches because we're asking them to coach differently. So we're saying, yes, you're a really, really good boxing coach. Yes, you're extremely experienced. And you're working with these young people who have a level of difficulty that you don't come across in your gyms usually, because they're the kind of young people who couldn't get themselves to an amateur club and succeed, I don't think, because they need more from an adult than you would get in an ordinary kind of group context. They just need an awful lot. And so we're asking our coaches to do something different, to engage with some new ideas, to be humble about joining with different ways of working, and they really do that, and that's really great.
Well, I don't know whether it is asking coaches to do something different, but I suppose from my point of view, you're asking a coach to be what I would call a psychosocial coach, which is, if we've got the technical and the tactical and the physical sides of sport, so let's take the technical side of boxing, the tactical side, the physical side of boxing. Historically, we're so socialized as coaches, sports coaches, into, well, that's what it's all about. And there's kind of this mental side, this psychological side, and social side that are floating around somewhere, but coaches are like, hey, this is really important, these two sides, but we're really just going to focus on the tech, tac, and physical sides. And I think almost inadvertently, Kathy, what you're doing is a vital role within the community and coming from a clinical psychologist perspective. But I can tell you now, as a sports psychologist, this is like music to my ears. I would have every single football coach, basketball, baseball, golf, tennis coach doing this kind of thing. Okay, it's an extreme version, but doing this kind, because they become better psychosocial coaches. They are coaches of people.
And that's it. I mean, for me, coaching is a relational task. It's relationship first. And I really believe that if you can, you coach the boxer that's in front of you in terms of what they need relationally first, I think, in order to then get on to have enough space to be able to think with them about tactics or, what the other physical aspects of the sport. So for me, there's something about the relationship being to the fore over and above everything else, because actually if you don't get that right, I don't think your boxer's going to take in what you want to tell them anyway. Now, I know different people have different views on that, but I suppose I think there's also something about how coaching changes over time. So, I know England Boxing, in their kind of current training of coaches, it's really 360 the way they train coaches. They're interested, really in the kind of the 360 around the boxer, welfare, life outside of the ring, really kind of moving towards helping people reflect on their performance more, which is really heartening. And so I think there is movement towards that way of thinking in coaching that I've seen. I suppose because we're a therapeutic project, I guess we're interested in their emotional well-being above everything else. If they perform as well, that's great. If they go on to be elite boxers as well, that's great. But we definitely have the relationship to the fore, and as the kind of the real, I suppose, just the thing to prioritise above all else at all times.
No, look, absolutely. I love what you said there about coaching is relational. And for me, it's as you said that, I'm thinking absolutely, and it's not transactional, it's relational. That's so important. And yes, you are, first and foremost therapeutic, but there's a real paradox there, in as much as coaching environments that are not therapeutic in nature, and sort of 99% of them, I guess, or 99.9% of them aren't. They're about participation in sport and progression in sport and performance in sport. Actually, paradoxically, if they did what you do, or close to what you do, or closer to what you do, actually participation would increase, and you would have lifelong participants, because there's a big dropout rate in sport.
Yes.
Competitors in all sports would progress quicker, more effectively, and enjoy that progression, and performances would be better. It's really as simple as that.
So it's interesting, because obviously we don't, our focus isn't elite athletes, but I've trained in competitive squads, and it's interesting what you say about enjoyment and about dropout, because I think, so as a therapist, if someone stops coming to therapy, we're really curious as to why. We're like, we used to see this young person, they don't come anymore. What's that about? And what's my role in that? Because I'm guessing there's, therapy is a relationship. So there might, you have to kind of think about what's the part you've played in that. And I think it's interesting, because I think with sports, people drop in and drop out. I'm not sure how curious coaches are about that, Does that make sense? Sometimes there's a narrative that's kind of like, oh, people come, people go. And it's like, well, yeah, but they could be coming all the time. So if they're not coming all the time, yep, there might be all sorts of things going on with them, but there might be something going on with them and you, or them in this gym, them and the other people in this gym. And actually, if you can kind of work on those relationships and keep things fun, that's really important too. So I suppose the other thing we really do in the group is we're supervised by a child and adolescent psychotherapist, and the boxing coaches go to group supervision as well. And actually, at all times, we're thinking, how are the coaching team getting on together? What are we demonstrating and role modelling to everybody about how we relate? How are we getting on with our boxers? And how are our boxers getting on with each other? Because all of that contributes to your environment, and your environment is the context in which the change happens. And I guess that's true whether your change you're looking for is kind of change in emotional well-being, or whether the change you're looking for is development in boxing skills.
Look, this is exactly why I wanted to get you on the show, because this is just dynamite. This is just brilliant stuff. Because reflection, you said they're reflecting on, so as a therapist, why has this person not come back to see me, and reflecting on why that might be in your role within that. And you're quite right to question whether coaches do that. And we're not kind of finger pointing and finger wagging at coaching, because coaching is a really hard hobby or profession. It's one of the toughest. It really is.
It is. And sorry to interrupt, because also, I mean, I don't know what other sports are like, but boxing is run by volunteers. I had no idea until I was in an amateur club that these amazing high quality coaches are volunteers. And amateur boxing is generally 90 minutes to 2 hours, Monday, Wednesday, Friday, plus like invited sparring every week. So it is absolutely, they work so hard.
Absolutely.
They work so hard, so maximum respect.
No, absolutely. Welcome to the world of grassroots sport.
Unbelievable.
That is how it works. Brilliant volunteers, and it's really important to say that. I'm not, or what I'm interested in is passionate, professional and grassroots coaches, and obviously the grassroots are volunteers who are just interested in getting better. And sometimes it's easy as a coach to mean well. You want to do really well. You want to do well for the young people and the adults in your sporting group, but often you can have blind spots because, again, Kathy, I think it comes back to we're socialised into, hey, it's sport, it's about performance, hey, it's about developing skill, hey, it's about it, and actually not necessarily connecting the dots in terms of the psychosocial with those the technical, tactical, and physical area. And so what you're saying though is that self-reflection piece. Don't underestimate how important that is for a coach. Even if you're a volunteer, where maybe the self-reflection might happen as you're driving back or you're getting the train back home after a couple of hours, a long, hard boxing session, it affords the opportunity to reflect and ask yourself, well, that person hasn't come back. Is there something I did? And is it something I've set up in my gym that has stopped them from enjoying it? Or did I stretch them too much? Or did I ask the wrong questions or something like that? Does that make sense?
Yeah, absolutely. And I think what you said about reflection is really key. Like, you don't have to keep a reflective diary and write like 200 words. Like, you can just have a little word with yourself in the changing room for like 2 minutes. I think it's just that it's that mindset of kind of just kind of thinking about yourself and yourself in relation to others.
Absolutely. Well, let's dig down a little bit on what a session looks like, if I may ask, when a young person engages in your corner session, because it's pretty, I believe it's sort of 50-50 balance between boxing activities and emotion focused work. Would that be right?
Sure. Yeah, it is. So I suppose the first thing to say is we're not an open group. So it's not like sessions that you can come in and out of. Yeah. It's a closed group that we're really quite careful over who we put together. So all the young people who come are referred in from targeted services. So they might come from child and adolescent mental health. They might come from youth offending. They might come because they've got a social worker. They might be looked after, which means they're not living with their family. So so the expectation is they sign up to a block, and that the blocks sort of, the people in the block stay together. Yep. So basically we're co-facilitated. So there's always 3 coaches in the room, and there's always a lead for boxing, a lead for thinking on each task. And in the main, I guess we try to do a lot of things to help the young people succeed. So something that boxing lends itself to very naturally, but that we are really hot on, is structure, because actually a lot of my work is informed by an attachment and trauma model. Okay. And I suppose what attachment and trauma would say is that a lot of young people who are coming into a new environment to learn something new with a bunch of people they don't know and a bunch of coaches they don't know are automatically going to be on absolute high alert. They are going to be hypervigilant to threat, feeling like they're going to be made to look stupid, highly anxious, and that anything we can do to kind of bring that down, we will do. So we visually timetable everything. The structure always stays the same, and then we change the components. So it's a little bit like getting your WOD if anyone does CrossFit. You get your whiteboard, you know broadly what you're doing and for how long, but you get a very clear visual timetable of what you're doing, and we work our way through it. So all the kind of clinical psychology elements, which in the main kind of draw on CBT and DBT in terms of the skills, we will embed them into why they might be useful in your boxing, or give them a boxing frame to make them more kind of accessible and relevant.
That's awesome. So what I hear you say at the end there is that you help them acquire some emotion regulation skills, and then you give them a platform to go and practice those when they're boxing. I'm just going to read a little paragraph from your paper. You say the English language is bursting with common phrases that use boxing metaphors to communicate aspects of experience. To name a few: throw in the towel, roll with the punches, on the ropes, knockout, blow by blow, let your guard down, take it on the chin. Fantastic. And my interpretation of this is you're having conversations with young people around boxing. As you said, you would use boxing examples, but also the language of boxing to help them label some of the challenges they have in their everyday life, which ultimately can help them to overcome those.
Yeah, because I guess because a lot of those phrases and narratives sort of lend themselves to the idea of resilience, and actually these are young people who've often been knocked down, more than once by life already, and so that idea that you kind of have found a way through and you continue to is a really important one. But I suppose we come at narratives sort of 2 ways. So one is around sort of using the narratives and the ideas within boxing to bring something to life from a kind of psychological perspective. So like, for example, in boxing, we talk quite a lot about trading. So I don't know if you've ever been to a fight and you've heard people say, don't trade, don't trade. Right. So like, if you trade, you're getting in range, they're trying to get you in range to punch you, and you're just being like, oh cool, yeah, let's have a fight. And actually that's not the wise thing to do. It is not wise to trade. It is absolutely wise to do something else. So to slip, to roll, to stay out of trouble, to move out of the way. And actually, if we're thinking about trading in relation to kind of feelings, your feelings might want to pull you in to doing something really reactive, something really aggressive, something that you're going to regret when your thinking mind is back on. Actually, if you can think, if that's trading, what else can I do here? What would I do in the ring? I'd pivot, I'd step around, I'd step out, take a breath and come back in. I'd flex, I'd do something different. Actually, it opens up an idea over that psychologically we can be flexible. Like just because a situation happens, we don't have to come at it the same way. Actually, if we always came at things in fights the same way, we'd be a predictable fighter. We wouldn't be very effective. So how can we kind of come at different situations in a sort of wiser way, where we're not trading and getting ourselves caught up? So I guess that's one way we come at narrative. And then the other way, which is kind of broader, is about how can the group in itself find a way to support a development of an alternative narrative about the young people who are taking part. And that's a bit of a wordy way to say it. But what I mean by that is I'm interested in the power of stories about young people. And I guess that's an idea from narrative therapy, where narrative therapy says everyone has a dominant narrative. about them, and that if you're a young person who's experiencing difficulties, often the dominant narrative about you is a problem-saturated story. And so what you would try and do in narrative therapy is co-construct with a young person an alternative narrative about them. So that might be a narrative about strengths, skills, abilities, times they've resisted a problem narrative, times they've overcome something. And you'd also try and publicise that narrative with them to important people around them to hold that new story with you. And that's something we also try and do in the group. So we're interested in how can we capture these changes that are happening, be that through video or through words or through witnessing, and how can we invite important people in our young people's lives to come and witness that, so that we can begin to kind of create with them a kind of richer and different story about how they're doing in their life, through what they're doing in the gym, kind of changes they're making.
I love that, and as you're speaking now, it reminds me of the work of a guy called Dan McAdams, who's at Northwestern University in Chicago, and he's a personality scientist, and he talks about how personality is heavily mediated by your narrative identity, and your narrative identity. We're storytellers. We tell ourselves stories about our lives, the people around us, what's happening, and that mediates how we feel about the situation and subsequently our behaviours. And from the world of sport, if you've got a footballer who's been, and obviously I'm not talking about serious issues here, I'm just talking about football and a footballer being dropped from the team.
But that is serious. Like, it depends how resilient you are, but like if you're, maybe I'm just overly emotional, but like honestly, if you've committed and then you're dropped, like that can be crushing, I think.
No, look, and thank you for saying that, because I do try to come across as if an elite footballer or a developing elite footballer, or even a participative one, right, isn't in the team, it's so much of their life, and I try not to make it too serious, but at the same time, it is, Kathy. It's if it's meaningful to you, your body will react, won't it? And your brain and the nervous system will react in the same way as a serious stress response.
Yeah, totally.
And you're devastated. But and that's a big part of my role as a sports psychologist, is to help players have a more flexible, adaptable narrative around the challenges that happen to them.
Yeah, it's interesting, isn't it? Because there are so many challenges, injury, or not making the first squad, or not getting the outcome in the competition that you wanted, or whatever it is, or pain, or being in physical pain because you're pushing your body so hard. There's a lot of those challenges that you need to kind of find your way through.
Well, if we come back to boxing, when you've got a boxer in camp, an elite one, preparing for whether it be a world title at the very top of the sport, or their fifth bout where they're climbing up the rankings, or their first bout, or if you're just a recreational boxer, the stories you tell yourself Monday, Tuesday, Wednesday, Thursday, Friday, going into a fight, say, at the weekend, are going to mediate your capacity to fight confidently, strategically, focus your attention, etc., etc. So the stories you tell yourself matter and they're going to mediate how you fight in the ring. Yeah,
I absolutely agree. Definitely, from my position as a psychologist, and also I know when I'm boxing, I know I can talk myself into or out of a good performance very quickly through those kind of stories I'm telling myself on the way to training, on the way into the ring.
So here's a question: have you utilised your tools and techniques, or a part of that CBT, say, to be able to manage yourself going to the ring, or doing that yourself? Do you find that quite difficult?
No, I am quite open about the fact that one of the reasons I think I really took to boxing is because it really helped me manage my mind. There was something about high impact sport, really high impact sport, that just kind of helped my mind be a bit quieter in a way that I really liked. And I think that's one of the things that really appealed to me in the first place. I'm quite a naturally kind of fast person, and I can be a bit underconfident when it comes to sport, I think. So actually, I absolutely practice what I preach. So like, I'm really interested in kind of thinking on the way to training, you know, because it's London, so you're always on the train, like
Yeah.
on the way to training. I'm always thinking, okay, what mood am I in today? How's that going to affect things? You know, how am I feeling energy-wise? How am I feeling kind of psychologically? Am I feeling confident? Am I feeling good? If I'm not, what do I need to do about that now? Because actually, I'm not going to perform unless I start telling myself some stories about, you know, competence and confidence and effectiveness. So I definitely do that. I definitely look after my breathing as a way to kind of keep my body, you know, kind of appropriately on. I don't know what the right word is, but like, I guess with boxing, I think it's really easy to get overstimulated and get a bit wild, just because you're like, your fight or flight can kick in.
Yep.
Because someone's coming at you. So actually, I think you need to know what you need to do whilst you're boxing to kind of, if you notice yourself getting a bit wild or a bit fight or flight, you need to think, okay, I need to down regulate now. How am I going to do that? So I definitely use some of the stuff on myself. Because I think managing your mind is kind of important in all tasks, but especially in boxing.
Absolutely. And when you're saying that to down-regulate yourself, we use the horrible term levels of arousal.
That's all right.
Yeah, whereby if you become over-aroused, but basically what happens is, there's a number of physical things and physiological things, but you will experience tunnel vision, obviously, so you won't necessarily, in boxing, you still want to be able to look at the various cues that are emanating from your opponent.
See those hooks coming?
Yeah, exactly. And if you're running around like a headless chicken, then that's not necessarily going to help. But also, as you say, you've got to be disciplined in your approach in the ring, and you've got to stick to a certain strategy. And obviously, when you're over-aroused, you probably won't stick to a certain strategy. The front part of your brain will probably switch off, and you'll be emotionally driven. And that can be the end of that.
And it's interesting because, like, in the corner, I'm really interested in what what coaches do in the corner, because you've got a minute, and you see lots of coaches doing a lot in that minute. You know, like giving a lot of information to their boxers in a minute. And I guess my sort of take on that is that actually your capacity to think in that minute, particularly in the first 30 seconds, is not going to be very good. Like, actually, how can you help your boxer down regulate enough, like take enough breaths, calm themselves enough in that first 30 seconds to take on like a couple of key points, and then, get themselves up, motivated and ready to go within the minute. I think for me is the kind of key. Actually, like, your capacity to take on technical information in those moments. You can take on a bit, but you haven't got the space in terms of your thinking mind to take on much more, I don't think.
I think that is such a salient point. I really do. I think that's brilliant. And as you're speaking there, I'm kind of picturing the cornermen, and I'm thinking about that. They're passing over so much information, and really, can there be space for 30 seconds of recovery, for instance, where you're treating your boxer's face and just giving them some downtime to take some breaths even, and that can be a fight strategy, is that in the first 30 seconds, this is going to be the routine, and then I'm going to give you 1 or 2, maximum 2 points. I might get your feedback as well, so it's a bit more co-created, and then away you go. So I think you're spot on there. One of the interesting things I actually posted, I did a little article on this a few months ago after the Tyson Fury Wilder fight. And there was a really interesting line, there was a really interesting bit of communication that Fury's trainer had with him. He said, watch for Wilder taking a back step and lowering his hands. Right. That is his mental break in concentration.
Ooh, interesting.
Yeah, okay. And you can capitalize on that. And I was like, oh, that's awesome, because not only are his hands dropping, it's also communicating to Fury, there is a mental break in concentration. He's linking the technical side, dropping the hands, to the mental side of that's a break in concentration. There you can step forward, for example. I'm just thinking about that 1 minute. What I'd say, Kathy, is there's a trainer, a boxing trainer, who's really paying attention to the mental side of sport, which I think is great.
Yes.
Which I think is great. Now, I'm mindful of your time, and I've just got a couple of more questions.
Sure thing.
And I know that you've got you do other little things as well, which seems really cool. So you get the participants engaged in filmmaking. You're doing a filmmaking project as well, or something?
Yes. So this links to the idea about narrative, because when we did the pilot in 2017, to be honest, I had a friend who was a filmmaker who works with young people, and she said, I'll give you some filmmaking time for free. And I thought, all right, nice one. Like, I didn't think about it too psychologically. I just thought, okay, that's cool. It's a different way of engaging the young people. Let's see whether they're into it. And they were. But the thing that I thought was really powerful about the film, again, comes back to narrative and how we see ourselves. And so how can being in a film and seeing yourself on film doing something both help you develop a different narrative about yourself? So seeing yourself look powerful, seeing yourself mastering a new skill, seeing yourself surrounded by a community of boxers, in this space that is yours, that you own, this boxing gym. How can that help you feel different about yourself and your possibilities as a person? And how can seeing that video also support other people to see you differently? So actually, for me, the content of the filmmaking's cool as well, but it's also, I think, psychologically really powerful because it invites sort of reflection, I guess, by being able to kind of get meta to yourself and have other people get meta to you, if that makes sense.
Yeah, no, I love that, and it almost has a self-efficacy feel about it, in as much as producing a video and being able to watch back what you've achieved has a sort of a constant. I can constantly affirm my past successful experience. I've been successful here, to build self-efficacy, self-belief. I think that's fantastic.
Yeah, absolutely. And I guess the young people this time round, what we're hoping to do, we've just broken for summer, but what we're hoping to do in September is they're hoping to make some short videos for social, where they are both in the videos, but kind of, presenting to other young people like bits of boxing skills and bits of chill skills. And I think that's so great, because it's like, the student becomes the master, create some engaging content for other young people to get them into boxing, or to kind of start a conversation about what you've gained from it. I think that's really powerful as well. So I'm excited to what they come up with for that.
Well, that filmmaking project sounds like a really, really good accompaniment to the narrative therapy that you're delivering. And so you said you've broken up for summer and you're back in September. So what does the future look like for In Your Corner?
Well, the future over the summer is that because I'm a psychologist, I obviously am a bit of a geek about data. So in the summer, I'm looking at my outcome spreadsheet and thinking about effectiveness. But after that, the largest project In Your Corner involved with is a project called Connect. So that's a partnership in Southwark with London Community Boxing, which is an amateur club there, and that's we're going to be entering year 2 of a 3-year funded project by Comic Relief. So it's really, really great to have that project, because it just gives us the time, because it's a 3-year kind of scale, to really try out, test and refine what we're doing, and just keep working on effectiveness, and just keep really making sure that we're meeting that local need.
What's that project called again?
So it's called Connect.
Connect, and that's in conjunction with Comic Relief.
Yep, so that's funded by Comic Relief, and the partnership is with London Community Boxing.
Fantastic. And so would the goal be to broaden things, to have a few more sites? So
the goal is to reach as many young people as we can. So both through kind of scaling through direct work. So we're always interested in partnerships with amateur boxing clubs in particular. And that's for more than one reason. It's because we really like to be embedded in local communities, and amateur boxing clubs are. But also they provide a really good exit from the project or something to do alongside. So, for example, there's a subset of our boxers who will get the bug, start with us, and then want to go have the ability to compete. And we absolutely want them to do that. And actually, if we're partnered with local clubs, then they've got their junior amateur route where they're already in a place where they know people, trust people, feel at home, and they can just transfer into amateurs and off they go. Whereas actually sometimes transitions can be hard for these young people. And so if they transition out of the project into another club, that just needs to be kind of carefully managed and carefully supported so that they feel able to succeed somewhere new and build those relationships. So outside of that project, we're scaling, and then we're also developing relationships with other settings. So actually educational providers, so both mainstream schools and like alternative provisions, or schools that are specialists for social, emotional and mental health difficulties, and working in partnership with them to just reach more young people working in this model.
Well, Kathy, this is really inspiring stuff. And before I get you to tell the Sports Psych audience where they can or how they can get in contact with you, I just want to I've written down a couple of testimonials, if you like, that I've captured from a video that you've done, which is on YouTube. And one of the young people says, "Coming here gave me a place I could lay out all my stress. I've met friends here. The people here are incredible, and boxing has definitely changed my life. I had a lot of hate and people pointing down on me. Boxing has taught me that you tell me that I can't, and that's why I will." So I think that's testament. That testimonial is testament to the work that you're doing. So that's thoroughly inspiring stuff.
Just hearing that makes me smile so much, because that young person is amazing. And it's such a, you know what I mean, like. It gives me great joy, and I know that sounds really cheesy, but like that's the heart of the work. Like, that's why we do it. So to have people come and say things like that is just brilliant, because that's what we're hoping to do, and if that's what they also take away, then great.
One of them even used one of the metaphors. So she said the group is like a gang, we're like family. In life you're going to get knocked down, but you've got to get back up again. So she's using your boxing metaphors. Superb.
Absolutely. And that's that's what we would hope, that actually what you learn in the ring and what you learn in session, you apply to life, and that we're clear with all our boxers really that we're interested in setting goals with them around boxing, but we're more interested in setting goals with them about life, because actually, boxing's part of their life, but they've got to be able to form relationships and connect with people in life, and that's what we really want to help them do. And that's why the project in Southwark is called Connect, because it's about how can they feel a sense of connection to us, to themselves, to the people around them, to their feelings, so that they can begin to navigate things differently.
Well, that's Connect, In Your Corner, and Connect, which is going to be supported by and funded by Comic Relief. Now, I know there's going to be a lot of people out there who would like to touch base and maybe get more information or just know more about your work or whatever. So what's the best way that listeners can follow you or find you?
Sure. So In Your Corner is on social. So we're on Twitter, Facebook and Insta, and it's at IYC Boxing. Our website is inyourcorner.uk.
Awesome. Well, look, Kathy, thank you so much for coming on the show. I really appreciate it.
Oh, thanks to you. It's been really, really fun.
Well, I really enjoyed that podcast, and I'd love to hear what you, the listener, thinks. So please do get in touch via Twitter or Facebook or through my website, danabrahams.com, to tell me what you think of the Sports Psych Show. And if you do have any suggestions, I'd be delighted to hear them. I'm really looking forward to next week's episode. Bye for now.